What are the key topics in patient education for Lymphoma Resources? When it comes to understanding lymphoma, especially non-Hodgkin lymphoma, there are several key topics that can help patients navigate their journey. First, it is essential to have a basic understanding of what lymphoma is. Lymphoma is a cancer that affects the lymphatic system, which plays a crucial role in the immune system. It is important to know the difference between Hodgkin lymphoma and non-Hodgkin lymphoma, as they have different characteristics and treatment approaches. Next, patients should be informed about the diagnosis and staging process. This includes understanding how doctors diagnose lymphoma through methods like biopsy, imaging, and blood tests. Staging helps to determine the extent of the disease, which is vital for planning treatment. Speaking of treatment, patients need to be aware of the various options available. Common treatments include chemotherapy, immunotherapy, targeted therapy, radiation, and stem cell transplants. It is important to emphasize the goals of treatment, whether they are curative or palliative, and to follow evidence-based medical care. Side effects are another crucial topic. Patients should learn about common side effects, such as fatigue, nausea, and the risk of infection due to low white blood cell counts. Knowing how to manage these side effects and when to seek medical help can significantly improve quality of life. Nutrition plays a vital role during treatment as well. Patients should receive guidance on maintaining a balanced diet, focusing on fiber intake, food safety, and when to consult a dietitian, especially if they experience eating difficulties or weight loss. Infection prevention is also important since lymphoma and its treatments can weaken the immune system. Patients should understand neutropenia and learn strategies to reduce infection risk, including proper hygiene and avoiding certain foods. Mental health and psychosocial support cannot be overlooked. Addressing emotional well-being, coping strategies, and available support services is essential. Patients should feel encouraged to communicate openly with their healthcare providers and seek support from groups. Follow-up care and monitoring are critical for managing long-term effects and monitoring for disease recurrence. Regular appointments help ensure that any changes in health are addressed promptly. Patients should also be informed about clinical trials and emerging research. Understanding that participation in trials is voluntary and based on current scientific evidence can empower patients to consider new treatment options. Lastly, it is vital to emphasize that patient education should complement personalized medical advice from healthcare professionals. Patients should feel encouraged to ask questions and discuss any concerns with their medical team. By covering these topics, patient education resources can empower individuals with non-Hodgkin lymphoma to understand their condition better, engage actively in their care, and maintain a good quality of life throughout their treatment journey.